Hey, this is Dr. Keith Hersey, and you are listening to the Destroying Diabetes podcast. Hello, hi. Thank you, everybody, for joining us again. This is Dr. Keith Hersey, and I am the host of Destroying Diabetes. Welcome again to my podcast, and I'm glad that everybody has been able to come out and support us, and we welcome all the support that we get. It's just a blessing, everyone that we have, and all your feedback is greatly appreciated. Like I said, I read every single one of your emails. I don't have a staff to do that. So I appreciate it. Keep them coming. And like I said, I'm still looking for my first email from someone outside of the United States. I haven't gotten one yet. So if you're outside the United States, and you listen to this podcast, please send me an email. Just let me know that you're listening so that I can say I have someone outside of the United States listening to my podcast. And also, I'm glad to talk with everybody. Like I said, they let me back in the building, so I must be doing something okay. They didn't lock me out. So I said, until they lock me out, I'm gonna keep doing podcasts until they lock me out and don't let me back in, and then I'll know it's a wash. So I'll walk away. Anyway, thank you again for uh, paying attention, listening, watching wherever you have an internet connection. Today is a very special episode because I'm going to be joined by Ken Sternfeld. He's a visionary leader in pharmacy intervention, and he is the founder of the DiaBuddy program, which is like a peer support coaching initiative designed to provide personal guidance and connection for people managing diabetes. And I also like to announce that I've been newly appointed by Ken to be the Director of Experiential Learning at CareSync Concierge. And so I just want to welcome Ken to the show. Hey, Ken, how you doing?
Well, Keith, I'm doing great. And if they ever lock the door on you anywhere, you call me because you and I go back a couple of years, and I think you're a powerful proponent for patient care, certainly with diabetes. And your focus of destroying diabetes aligns right with our passion to do that because we are at war with diabetes. So I want to thank you for having me on the show today.
Okay, well, thank you, Ken. So, as I said, I'm glad to be working with you and working with the others at CareSync Concierge. So thank you for the opportunity. I'm excited to be working with pharmacy schools, clinical partners, coaching programs, other pharmacists and healthcare professionals, and helping future pharmacists. So, think we're building a great program to provide the human connection to a serious disease. So, if you want to give a little bit about the program that we run, the DiaBuddy program, and what inspired you to create it.
Well, what inspired me to create the Diabuddy Experience is my brother sadly had diabetes, and due to the challenges and the comorbidities, he kind of lost his battle about 30 years ago. So I've always had a passion to do something to honor his memory, but also to do what I can to make sure that others don't suffer. CareSync Concierge is a group of pharmacy students and pharmacists who mentor them, like you and me and others, to kind of show them there are more things to do by doing things remotely now in a new post-pandemic world. We know all about the medications. Your company as Meds Manage is really important. The medication is important, Keith. But from our perspective at CareSync and the DiaBuddy experience, it's about lifestyle modifications. Because there aren't enough medications to cure this disease, we want to stop it through prevention. So you've joined our company, and I'm thrilled because we're going to educate, empower, inspire, and then hire pharmacists, PharmDs, students of pharmacy, healthcare professionals who want to make it a better world. So the DiaBuddy Experience is a telehealth solution that connects healthcare professionals to the patient directly. We are a direct patient care provider. And Keith, I use that word purposely because our team are providers. We call them concierge service providers. Doesn't matter what the letters are after your name, it's what's in your heart and your desire to help others. So the DiaBuddy experience allows you to work from home, make your own hours, practice at the height of your professional skill set, and earn as much money as you want. Because it's a lot better, Keith. I found this out after working 10 years for CVS. It's better to earn money by doing good than to make money by working for the devil. And when we dispense medication, we are working for PBMs. They're necessary, but we want to educate patients on medication. That's why I love what you're doing with GLP-1, because GLP-1 is a great drug, but if you just inject it or utilize it and don't have education, it's not going to work. So that's why partnering with you, strategically aligning, so you can mentor students from the North Carolina area. We have over 30 affiliate relationships with colleges of pharmacy and universities nationwide. And your dream about having an email from someone outside the country is going to happen because I mentor students. I'm doing one right now in China. We've done it in Dubai, in the Philippines, in Canada, in Puerto Rico, in Canada. Because with our telehealth internet-based solution, like you said, if you have internet and you're in the sound of our connection and our voice, we can help you. It's a passion of mine, Keith, and I really give you all the blessings and all the thanks for allowing me to share my passion for doing good and to make it a better world and put pharmacists at the hub of healthcare. Thank you, Keith, for the opportunity.
Oh, thank you, Ken. Thank you for the opportunity. I think part of the reason why I joined your organization is that well, what you're doing. I think it's forward looking. It's treating the disease, not just the conditions, because the goal should be, what why I got in pharmacist, and I'm sure from everything that I know about you, why you got in pharmacist was ideally was to, to help people, not to just manage their conditions, but just to alleviate them if possible, to be in the uh, mitigation and curing standpoint, not just giving people medications to treat symptoms and
Right.
forever. So I'm very appreciative of what your the DiaBuddy experience can provide pharmacy students and also pharmacists that may be wanting to change. They may want to get from behind the counter. They may want to practice what they kind of went to school for. People told me a long time ago when I was in a community pharmacy, nobody gave us a class on insurance, or nobody, no one had a class of dealing with those things like that. That's not necessarily what we study, but a lot of times, especially if you're working for the big chains, that's basically what you're doing. You're doing that, and you're doing it on a a time system, and also just everything is about metrics now with them.
We don't do
Just a
any of
bunch of
that.
numbers. Yeah.
Keith, we don't bill insurances. We are a concierge service provider. And basically, we offer health assurance for less than $1 a day. And no matter what insurance you have, no matter even if you don't have insurance, you don't need a prior approval. to be cared for. Keith, I don't know if the numbers of 1 out of 3 Americans and globally have pre-diabetes. So our target, even though we work with the Diabetes Foundation and all their resources for the last 3 years to do the care coordination and the services that you provide, we are going to look to prevent the onset of type 2 diabetes by offering lifestyle modifications and doing the diabetes prevention program, this DPP certified by the CDC as the only evidence-based program that has been proven to reduce the onset and delay and possibly eliminate the type 2 diabetes. 1 out of 3 Americans, Keith, 98 million. That's our target. So when you go out on your LinkedIn, and I go out on my LinkedIn, linked out, it's about what pharmacist wants to even take 1 day a week off from retail pharmacy hell, which is what I did, to practice at the height of my profession. Can you do it full time? Absolutely. Can you do it part time? Absolutely. Can you do it anytime you want? Absolutely. That's the paradigm shift that we've created for career development for pharmacists, PharmDs, students of pharmacy, anyone in the healthcare industry who wants to help make it a better world by dealing with this chronic condition and eliminating it. We must do it.
Yeah, yeah, it definitely. And do you know if you have a quick story about the success that you've
Sure.
had with a patient,
Sure.
like if preventing diabetes
Absolutely.
or working with that, working with them to mitigate their conditions if they had it?
Absolutely. The Diabetes Foundation and I work with them as every other Wednesday, and soon will be every Wednesday. We get patients who go to them for care. I am the DiaBuddy, the DPP, the prevention guy. And we have classes, general meetings, and in 20 minutes, I identify what their need is. And we set them up with the DiaBuddy Experience Program, and we monitor them via telehealth, and their A1C is going down, they lose weight, and they don't get diabetes. I don't have to give you one testimony, but if you stay on the program in 6 months and you lose 5 to 7% of your body weight, which is not a lot, and incorporate 150 minutes of moderate exercise, I'm not talking about the treadmill and sweating like crazy, you will reduce your risk factor by 58%. And if you're over 65, it's 71%. Evidence-based. Look at the studies for the last 11 years. So, Keith, the testimonies are if we can connect and be a DiaBuddy with that patient, don't call them to tell them their prescription is ready or needs a prior auth. I've made thousands of outreach calls. Now our outreach is, what can we do to help you? How are you doing? What can we do to walk with you on this journey? Diabetes is tough, and we want to avoid those people getting diabetes. It's a passionate relationship. How many relationships do we have? You had great relationships at retail because they came to you. But again, we were still focusing on the meds. 5, 6 billion prescriptions prescribed is enough already. Okay, I'm in a wheelchair and a walker because of an adverse drug event. Avoidable. So we need to know that 120,000 people a year die from an adverse drug event. That's more than breast cancer. So we educate, we empower, we give you the tools. We give you the opportunity to practice like you dreamed about when you enrolled in your pharmacy school 100 years ago, like I did.
Yeah.
Enough is enough. We've been talking about provider status for decades. How far along are we? Yes, there have been advancements in states, and God bless them. Thank you. It's wonderful. But if we didn't get provider status during COVID, when we were on the front line as essential healthcare professionals, when, Keith, we can't wait. People are dying. And CareSync Concierge wants to save lives. And we're bringing on anyone who's got a passion. Don't send me a resume because nobody's got a resume for the post-COVID era. And if you don't believe telehealth is a standard of care, maybe we can show you it is. Maybe we can show you how you can practice and connect with people remotely instead of flipping burgers at retail or clinical or anything. Patients want to be at home. They want to be cared for, and they want to know how much you care, not how much you know. Anyway, Keith, there's a passion that I have. So here's the deal. We want people just to say, that sounds interesting. Well, guess what it is? So I'm going to give you the opportunity for you to set up meetings, group meetings. We'll set them up any day that ends with the letter Y. So your listeners can learn more. You can't possibly learn in 15, 20 minutes the opportunity that every healthcare professional has to do more. So I that's all I'm going to do. I sent you,
Yeah.
we'll continue to send you information for you to share with your constituents, your followers. But let's get people to learn more about what you have committed to do because you're a warrior. You're a diabetes warrior. You want to destroy it, Keith. That's what I love about you.
Yeah, thank you for the kind words, and yes, that's exactly what we want to do. I mean, we want to be on the front lines of caring for our patients because that's why we got into this in the first place. So provide that personal touch that people a lot of times it's not possible a lot of times in a lot of the community settings because you're so busy, filling scripts and meeting make metrics so you can
We
keep
know,
your job.
we know. We
And
we know. Well, wouldn't it be
yeah,
nice to care for patients before they got the diseases that we had to deal with them in
yeah,
fast food pharmacy? It's
yeah,
before prevention. So, Keith, please put a survey or ask your listeners what days, what times they would be available, and I'll make myself available. And I can guarantee in 30 minutes, I'll walk them through the DiaBuddy experience. I'll show them the revenue. I'll show them the model. They own their own company. They don't work for us. They work for the patient and they work for themselves. So please encourage your listeners to set up, give you times, and we'll do it as many times during the week morning, night, evenings, weekends. Keith, we need to save lives, and pharmacists need to do more, and they can do more. That's the beauty of it.
yeah,
Thank you.
exactly. And again, we will have the links in the show notes if you're a provider and you want to add this to your workload, or if you want to make a change in your career, or if you want to just add something else where you can do more working face to face, more on your clinical, more toward what you went to school for. And if you're like, you like a provider and you want to have someone working for you on this aspect, I'm sure most uh, general practitioners, your room is full of uh, people in various stages of diabetes, from pre-diabetes to full-blown type 2 on the verge of amputation. So, you have patients run the gambit. Maybe you want someone to help you and help your patients, give them that care and give them from the aspect of someone that has a background in pharmacy. They know how the medications work. They know how to prevent people from going on the medications by following lifestyle changes that Ken is pointing out with the Diabuddy Experience. It's an outstanding program. It's a outstanding. Like Ken said, if give us at least 6 months, people's lives will be totally changed. They'll be going from headed toward diabetes to headed to great health, in
Keith,
that time period.
I started my concierge approach to healthcare over 10 years ago at the office of Dr. Michael Goodman, an MD-VIP concierge physician. And our listeners, whether they're pharmacists or doctors or providers, should understand that a concierge approach allows the person to take the time, make the time to take care of the patient. So we, because of COVID and everything else, we had to get away. We couldn't go into those offices. We had 18 practices that we had opened at different MDVIP practitioners in the New York area and a couple nationwide. Well, now we're going back. And on Tuesday, we are reintroducing the DiaBuddy Experience to an MDVIP practice, Dr. Scott Brown in Belmore. And that's the first of what will be dozens of replicable MDVIP practitioners. So if you have pharmacists in any part of the country who want to be able to work collaboratively, remotely, via telehealth with an MDVIP practitioner in your, there are only about 1,300 of them nationwide. So if any of your listeners put their own, go to mdvip.com and see where the providers are right in your neighborhood. And if you're interested in knowing how to get into that practice as a provider, you get in touch with Keith and you get in touch with me and we show you that pathway. So I'm glad you brought that up about practitioners, because when you collaborate and want to talk about the billing and the this and cutting it, it's a pain in the neck and it doesn't work. This is about care delivering via telehealth to practices that don't do it. And we can do it, and we are doing it. So thank you, Keith. This will be the first
Thank you.
of perhaps several engagements and conversations. I love the podcast, obviously. You love the podcast, obviously. So we're two podcasting pals, and we're going to kind of preach the gospel. It's kind of like
Yes,
a
sir.
experience. Okay?
Yes, sir. Yes,
Okay.
sir.
Thank
Yes,
you.
sir. Well, thank you so much. And Ken, I just wanted to thank you, not just for being here today, but your passion for reimagining pharmacy and patient care and what it could look like. And I'm truly honored to collaborate with you as we bring experiential learning and innovative diabetes coaching to the next generation.
Thank you,
And
Keith.
so do you have any closing remarks that you want to leave our listeners with?
Well, I've kind of gone with God on this process, and I'm not going to be religious because I don't believe in religion, but I believe the faith and the ability to do what's right and help your neighbor, help the needy, not the greedy, is written in the Bible. I'm a Jewish man who got baptized a couple of weeks ago. A whole other podcast will
Okay,
do.
congratulations.
Thank you. Because I believe we can make it a better world if we act a little differently than we do than things that are going on in our world. It's a very difficult world, a very angry world, a very fighting world. Let's show the love. Let's show the love that a pharmacist has for his or her profession and share that love with the patients. And I guarantee they won't hang up on you. They will hang up on you if you tell them to
Yeah.
go, in an automated call to pick up the
Yeah.
prescription. So if you don't want to get hung up on, go with your heart to those patients. They need you and they want you. So that's all I can say. Okay.
Okay. All right. Thank you so much, Ken. That's just wonderful words to end our podcast with. And I appreciate you, Ken, for coming by and letting us know, informing us of this great program. And this great program is great for patients. It's great for pharmacy students, give them valuable experience that they wouldn't get anywhere else. It's great for providers, may help take something off of their plate and help their patients as well. It's great for pharmacists. It gives you another avenue to practice at the top of your license. And you can then, like you said, you can choose how involved you want to be in it. And if it's something that you want to do just on the side, that's fine. If it's something that you want to dedicate full time, that's fine as well. It is what you make of it. So I think it's a fabulous opportunity, and we will have links in the show notes if you want to learn further about the DiaBuddy program. If you want to help us and if you want to participate in it, we'll have links in the show notes for you to reach out to me, Ken, and we can make it happen. So again, just thank you so much, Ken, for bringing this, having this program and having it available and just letting me be involved in a little way, involved in it. Every
My,
person that we can help, that's tremendous. Any single person that we can help.
Thank you, Keith. You
Okay.
said a lot of greats. It's great, it's great, it's great. But it means nothing if people don't get involved and do it.
Yes, sir.
Time to do it. It's a Nike time in our life, in our career, in our world. Let's just do it. Have a nice night to all. Thank
All
you.
right. All right. Well, thank you, Ken. So again, just be sure to subscribe to the Diabetes Destroying Diabetes podcast. That's so important. If we want to get out the number of our subscribers up in the stratosphere. So, we can spread the word about what we're doing here with this program, what we're doing with the podcast. The podcast is going to continue to share information about diabetes, about prevention, about treatment. We have been lined up in some future episodes, some great healthcare providers that's going to share their knowledge as well about the disease and different aspects of it. So I'm looking forward to talking with them and sharing that with you as well. So, and also just share this episode with somebody that's maybe pre-diabetic, may be type 2 diabetic, may be a caregiver of somebody that has type 2 diabetes. Just spread this information. The more people we can spread this information to, the more people that we can help, the better it is. Like Ken said, we got almost 1 in 3 people in this country that is in a pre-diabetic stage and don't even know it. As I've said before in my previous podcast, I didn't know. I didn't know until I went to a pharmacy conference and just got a finger stick, and they showed my blood sugar was through the roof. That's the way I found out. So we need this. Is a serious disease, but it's a disease that can be mitigated. People can live with the disease. People can even get to the point where they mitigate it so much that they have very little to no symptoms at all. So we're going to continue to do this. I appreciate everybody that listens to the podcast. Please send an email to us, give us feedback about things that you maybe want us to address in future episodes. I'm always looking, like I said, I read every single email. It's me. It's not a AI robot or something like that. So until next time, I want you to stay strong, stay focused, and stay blessed. Thank you so much. And we hope to hear from you soon.
Thank you for joining us on this informative journey. The content of this podcast is solely the professional opinion of the host for informational purposes only. It should not be considered a substitute for professional medical advice, diagnosis, or treatment. If you're experiencing any health issues or concerns, we strongly recommend that you seek the counsel of a qualified healthcare provider before making any changes.